Welcome to Mamaspace Yoga. I'm Carol Gray, and today I'd like to talk to you about the Mamaspace Yoga method. This is, by the way, this is Lois, and this is Lois's mother's pelvis, and they're going to help us later on in this discussion. But I'd like to talk to you about Mamaspace Yoga, the destination. Right now, we are a virtual destination. I presume that at some point we will go back to being an in-person destination. But more important than that, Mamaspace Yoga has long been a method. I've spent about more than 3 decades of my life as a body worker and also as a birth worker. I was a doula for, like 35 years, a really long time. And I was also a home birth midwife for 12 years, serving my community in that way. In fact, my experience as a doula is what led me to enhance my bodywork training and learn about craniosacral therapy. Back in the day, before doulas were called doulas, I used to call myself a massage therapist who also went to births. It's kind of a bulky title, but the word doula had not yet been coined to describe labor support work. And so I was a doula, and I saw a lot of babies who were getting born. I attended lots and lots of births, and I felt like the babies needed some help that I wasn't able to give them. These were medically normal babies, but some things just weren't quite right. Maybe they weren't comfortable in their bodies. They had difficulty with breastfeeding, many issues that I felt if I knew just the right kind of thing, there might be something that I could help them with using my bodywork skills. So ultimately that led me to study craniosacral therapy. And of course, my training in craniosacral therapy was focused around non-pregnant adults and non-newly postpartum adults, and certainly no training about babies. So I had to adapt the techniques that I was learning to treat just sort of a general adult population to fit the population I was really seeing, which was pregnant people, postpartum people, and also infants. Over the years, I managed to develop a body of work, and for the last 13 years, I've been teaching infant and perinatal craniosacral therapy. So my former students and I, and my current students and I treat a lot of babies, lots and lots, hundreds and thousands of babies we've treated in our free clinics in Portland over the last 12 years or so. And we're seeing an increase in issues. Of course, we're reviewing birth stories with the parents, and we're hearing more and more stories about babies getting stuck, babies who are in less than ideal positions for birth, more inductions, more labors that are prolonged and that don't progress normally, more cesarean births, more vacuum extractions, more babies who are in less than ideal positions. I'll talk to you about that. In a perfect world, Lois's mother would not be flat on her back, but that's the orientation of this particular pelvis. A pelvis kind of goes like this, right? Okay. I'll spin Lois's mother's pelvis that way. In a perfect world, babies' heads are going to fit perfectly in the pelvis. You can see that Lois's head is a little bit bigger from front to back than it is from side to side. And when she tucks her chin, the part of her head that would get born first is this part, and that's the smallest part. That's the way babies fit best. The upper part of Lois's mother's pelvis is wider from side to side than it is from front to back, and the lower part, the pelvic outlet, it has a greater diameter from front to back. And so it's not surprising that a baby's head would need to start out something like this and ultimately to get through this part of the pelvis and then spin around to come out to get through this part of the pelvis. We're seeing a lot of babies who have been born, who have been in just wonky positions for a really long time. These are the babies when we ask their parents, was your baby really low and in one position for a really long time at the end of your pregnancy? The magic question, The answer is always yes. Yeah, how did you know? And so the babies we're seeing are babies who maybe drop into the pelvis early on. And babies ought to be able to kind of move in and out of the pelvis until labor starts, really. But we're seeing babies that drop in and stay in. And the reason they stay down is because they get stuck. And if they get so stuck that they can't come back up, they're pretty much stuck so that they can't get out in the typical way as well. Seeing an increase in asynclitic babies, okay? That's where a baby's shoulder and ear are very close together on one side. The baby's got a C curve in their body, actually. This makes a much bigger presenting part. Military presentation, not a tucked chin the way they ought to go, but military. Again, big presenting part compared to this little bit here. And we're seeing occiput posterior babies. The occiput of the baby is back here. And when we say it's posterior, that means that the back of the baby's head is toward the back of the mother's body. That's not the way they fit very well. It's very hard to get those babies out. In fact, the baby's occiput, meaning the back of the baby's head, should be toward the front of the mother's body in order for the baby to get into a more ideal position for birth. But we're seeing a lot of babies who are trying to come through in those ways and hearing the stories of the aftermath when we're treating the babies later. But those twists and turns that the babies get that help them get stuck don't develop as part of the birth process. It takes weeks to develop that way, and these babies end up having just sort of twisted bodies. Let's say that Lois was facing like this for a really, really long time toward the end of her gestation. When it comes time to breastfeed Lois, it's really hard for her to nurse from the left breast of the nursing parent, whereas nursing on this side is always easier. We hear the parents that say, like, no, the baby likes this breast a lot better, and I must have more milk on that side. And maybe indeed they do, because the baby's spending more time there and transferring more milk from that side. And so we developed lots of craniosacral technique to treat these babies, even more technique to address these issues before they happen, techniques to make more space in maternal bodies during the entire pregnancy so that babies have the space to move into more ideal positions for their continued gestation and also to get themselves born. But more needed to be done. And so what I realized a few years ago, several years ago now, is that we needed a take-home program. We needed a way to antidote seated lifestyle. I believe that the cause of these problems is seated occupations for pregnant people. And of course, we've seen a dramatic increase in seated occupations for pregnant people in industrialized countries. Driving, car seats, and desk seats cause the pelvis to tip posteriorly. This is a side view. This is approximately the orientation of a pelvis, a normal female pelvis, when this person is standing, and should be when this person is sitting. But a lot of chairs, and certainly the seats in cars, tip this way. And that's part of the reason I think that these babies are dropping down and getting stuck in because they just randomly tend to maybe drop down this way, or maybe drop down with their backs toward their mother's backs, things like that. And stuck. And then we've got the recipe for the twisted babies who ultimately have great difficulty getting themselves born. So I've been practicing yoga for decades, and yoga is what I know. And so I embarked on a project several years ago now to develop particular yoga classes for pregnant people that, in addition to all the other wonderful things that prenatal yoga can do, would also have embedded in them particular sequencing that encourages more space in the maternal body, that makes more room for babies to get themselves into more ideal positions and ultimately get themselves born in a timely, efficient manner. And it's not about moving the baby this way or that way or positioning the baby a certain way. It's really all about making space. And of course, that's our motto, right? Making room for babies. That's what we do at Mamaspace Yoga. So I look forward to guiding your practice. I look forward to upcoming teacher trainings so I can teach other yoga teachers the mamaspace method. And more than anything, I look forward to helping you make room for your baby. Thank you. Thank you. Thank you.